COVID-19, like terrible diseases before it, has hit some of our cities badly. But cities fight back with science-based interventions and mobilized creative people, and usually with the support of higher levels of government and global community. Indeed, fighting the cholera epidemic, decimating 19th century London, led to the creation of epidemiology and the engineering marvels of the sewage system. Out of the past struggles with disease have come new ways to keep us safe, and the deep insight that human health is fundamentally linked to the environment, including how we build our cities. The novel coronavirus is reteaching us this insight. It has exposed our social protection networks as frail. An army of vulnerable workers provide services like food deliveries to the elderly, waste pickup and transit that are deeply essential, but aren't valued enough in how we've structured our economy. Indeed, often the same communities where many of these workers live are disproportionately unprotected, and they bear greater health burdens than others. Inadequate social protection is a risk multiplier, and our poorer neighborhoods are the least protected from environmental damage. COVID-19 is also showing us that many of the steps cities are taking to reduce emissions and support human health are also important for resiliency in a pandemic. Biking in cities, practicing social distancing has increased. Bicyclists deliver critical medicines and groceries to people in need, and more people are now using this mode as a way to travel safely in cities. Bogota, Colombia, made 47 miles of an entirely new bike network practically overnight. The virus has reinforced how valuable cycling is and how much more we could do to create a safe cycling infrastructure. Biking and walking are also safer because cars are off the street during the crisis. Traffic violence takes the lives of about 40,000 Americans a year and maims about 4 million more, racking up trillions of dollars in direct and indirect costs. In the lockdown, cyclists and pedestrians are much safer, and fatalities are plummeting in many places. Many cities have been working on street redesign, traffic calming slow, painful reallocation of city space from cars, and rewriting laws that remain lax on drivers. The virus raises the question on why we don't act more forcefully to reconstruct our cities to avoid traffic deaths in good times too. So if you look at Delhi, as somebody with asthma, the city's air, normally thick with pollution, is usually a health nightmare. But now, the air is clear, the skies are blue. You can see the evening stars with clarity, and you can hear all the chirping of excited birds. COVID-19 is also giving us an example of a future with clean air. We can see the decrease in emissions from space or from our stoop. Right now, it's due to a collapse in economic activity. But cities should come to see the value of putting a cost on pollution that reflects its cost on society. London has a very successful low-emission zone, and Madrid's was so popular that when a right-wing government tried to eliminate it, protests and a court victory made that really impossible. Here in the United States, the Trump administration is taking us backwards, reducing fuel efficiency and emission standards in the interests of fossil fuel interests and purchasers of dangerous and inefficient SUVs and trucks, even though there's a real no sticker price savings when one takes into account the massive negative public health and climate costs of this type of move. The administration is using COVID-19 as an excuse to loosen environmental regulations at the very moment when a Harvard study shows we may have more virus deaths on our hands because air pollution attacks and damages our lungs that are increasingly vulnerable to this disease. Fortunately, as a recent policy piece from Amy Turner shows, cities still do have legal instruments to work towards because like low traffic zones, but it's going to be difficult, slow work. Cities are also leading the call more towards mixed use, smarter, more compact land use, more and better transit, and non-motorized infrastructure, because this is a win-win. Reducing reliance on just one mode of transportation, like the car, increases choice and health and reduces greenhouse gas emissions. Those pose a very severe public health threat to the entire globe. Like poor societal protections, climate change multiplies existing dangers and harms public health through flooding, extreme heat, storms, new patterns of disease, and perhaps even new pandemics as microbes emerge from thawing ice. As with COVID-19, we all face this risk, but poorer frontline communities are going to face them even more. As we rebuild our economy after this crisis passes, we can't simply proceed as if our fossil fuel economy and car-oriented, sprawling urban development and consumption patterns have absolutely nothing to do with rising pandemics, serious chronic public health problems, climate change, and the great inequalities that threaten our cities and regions and our residents. There's a Green New Deal stimulus framework for how to reconstruct and create millions of cost-effective, clean energy and infrastructure jobs for our cities, but also the rural and suburban regions that connect them in one big economic muscle. Right now is the time to accelerate our efforts to protect ourselves and communities through a healthy environment. It's not really a luxury. It's the only way forward, and if we listen to scientists, we don't have time to waste. Thanks.